Okay, very sorry about that. Now you can start again. Sorry.
I'm just going to introduce myself again for the sake of the recording as well. My name's Robin Eames. I use they, them pronouns. I'm calling in from Gadigal land, and I would like to pay my respects to Gadigal elders past and present, and I would also like to affirm my solidarity with Aboriginal resistance across this continent. Colonialism is an ongoing and disabling process, and there is no pathway to disability justice that doesn't foreground Indigenous liberation. Um, I will be putting my slides online, and my segment of the presentation will be recorded, so don't stress if you need to duck out or if you can't stay for the whole thing. Um, Before I start, I would like to note that this presentation will mention names and information about Aboriginal disabled activists who have died. I'll also be touching on various kinds of violence, including state violence, medical violence, sexual violence. None of it's graphic or detailed. My focus is on resistance and protest, but obviously feel free to take a break if you need to. Um, Quick overview of what this workshop will cover. I'll be starting with some, I want to say quick, they're not quick. I'll be starting with some definitions of disability enablism and then getting into some case studies of disability activism, both here and in Turtle Island, colonially known as the United States. I'll talk about the differences between disability rights and disability justice, and then I'll have some points about types of radical organizing and tips for getting involved. So, what what is disability? Um, Disabled people are about 20% of the general population. Rates of disability rise with age and marginality. In Australia, about 6.8 million or 40% of the population report having some kind of disability or long-term health condition. Over half of people over 65 are disabled, and Australia ranks lowest in the OECD for relative income of disabled people. This is a quick guide to some kind of main models or ways of understanding disability. Keep in mind that our concept of disability is culturally specific. In many Aboriginal languages, they don't have a word for disability at all because people are supported in their communities and it isn't necessarily a relevant distinguishing concept. Um, so the moral or religious model is essentially considering disability to be a moral or religious affliction, often as a divine punishment for the disabled person or their parents. Charity model is like, oh, you poor things. It sees disability as an unfortunate tragedy and considers disabled people to be victims of circumstance who should be recipients of charity from non-disabled people. Medical model is locating disability as a medical problem in the body. Disabled people are seen as sick or flawed and in need of curing or fixing, and it defines disability in relation to the normal able body. Social model is one that considers disability to be a result of inaccessible environments or social exclusion. So disabled people have it sort of pushes the medical model onto the idea of impairments and then says that disability is the gap between impairments and accessibility. So as a wheelchair user under the social model, I'm disabled by stairs, not by the fact that I cannot walk. Um, or as I like to put it, in capitalist Australia, society disables you. Um, the biopsychosocial model sees disability as a product of many factors, including medical, environmental, and social factors, and it sort of integrates the medical model and the social model. The political relational model sees disability as a political category, produced through physical environments and through social and political ideologies. Disabled people are, under the political and relational model, a subjugated cultural group. Disability is a community issue rather than an individual issue. And it also takes into account chronic illness and chronic pain, which is something that, people often find quite hard to resolve under the social model. Um, and what we found is uh, the moral, charity, and medical models are increasingly being rejected by actual disabled people, and the social, biopsychosocial, and political relational models are increasingly being embraced as more potentially liberatory ways of understanding ourselves. Um, Keep in mind, not everyone who might fall under these definitions considers themselves disabled. Lots of deaf people consider themselves to be part of a cultural and language minority. So for them, their liberation is an issue of language access and cultural literacy, not necessarily an issue of accessibility or supports for physical deficits. Um, so now that we have hopefully, I hope I'm not like information overloading everyone. Um, but I think it's important to define our terms before we start. Um, so then what is ableism? T.L. Lewis defines ableism as a system of assigning value to people's bodies and minds based on societally constructed ideas of normalcy, productivity, desirability, intelligence, excellence, and fitness. These constructed ideas are deeply rooted in eugenics, anti-blackness, misogyny, colonialism, imperialism, and capitalism. This systemic oppression that leads to people in society determining people's value based on their culture, age, language, appearance, religion, birth or living place, health/wellness, and or their ability to satisfactorily re/produce, excel, and behave. You do not have to be disabled to experience ableism. Um, and I won't read all these out, but these are some examples of systemic ableism in Australia. In every area of life, we face hurdles that abled people do not, because we live in a society built by and for abled people. So, um, we have disabled people being legally employed for less than $1 an hour. We have, Australia has been condemned by the UN for forcibly sterilizing disabled women and girls. Disabled people are legally prohibited from migrating to Australia, and the Migration Act has a built-in exemption from the Disability Discrimination Act. So essentially, our laws say that we are legally allowed to discriminate against disabled migrants. That's the case with most modern democratic countries. So, for example, I could not migrate to the US if I wanted to because I would be seen as a burden on the health system. If I was not an Australian citizen, I would not be able to migrate here because I would be seen as a burden on the health system. And that's a reason that a lot of people get deported, not only because they're disabled, but because perhaps their children are disabled. Um, it's an ongoing issue. And there are many, many, many different areas where um, disability activism needs to intervene. History time. This is my favorite time. Um, so my absolute favorite anecdote from disabled history is the 504 sit-ins. And the 504 sit-in was about a month-long sit-in. It is, to this date, the longest occupation of a federal building in the United States. It was in 1977, a group of disabled activists led by disabled lesbians, including Judy Heumann and Kitty Cohn, and members of the Black Panthers, including Brad Lomax and Dennis Billups, um, staged a sit-in to demand the passage of Section 504 of the Rehabilitation Act, which essentially uh, the effect of that passage was that disabled people should legally be afforded rights and supports. Protest was successful. Ultimately, we can trace the passage of the Americans with Disabilities Act in 1990 to this sort of forerunning legislation. So the reason why we have global disability anti-discrimination legislation is because of this protest. Um, and so these activists are the reason why I can live at home independently. These activists are the reason I could go to uni, why I'm delivering this workshop today. It was a huge turning point, and it was also a really beautiful example of cross-movement solidarity. The sit-in was only able to be sustained for so long because they had a really high level of community support. They had the Black Panthers doing medication and food deliveries. They had support from local gay liberation groups and trade unions. The phone lines were cut off to the building, but gay lib groups smuggled in walkie-talkies, and they were also able to communicate with each other by having deaf people signing in ASL from the windows. And of course, the cops couldn't understand what they were signing, so it was just it was very sneaky. Um, this is a passage quoted from Dennis Billups, who's a blind Black organizer and a member of the Black Panthers. This was published in the Black Panther newsletter in 1977. And I returned to it often. He said, "To my brothers and sisters that are Black and that are handicapped, get out there, we need you. Come here, we need you. Wherever you are, we need you. Get out of your bed, get into your wheelchair. Get out of your crutches, get into your canes. If you can't walk, call somebody. Talk to somebody over the telephone. If you can't talk, write. If you can't write, use sign language. Use any method of communication. That is all. All of it is open. We need to do all we can. Um, Also in the 1970s, we have ADAPT, which was initially the Americans Disabled for Accessible Public Transit, and they later changed their name to Americans Disabled for Attendant Programs today. Um, they've been organizing in Turtle Island since the 70s, and they've made some massive wins. They were known for using the tactic of immobilizing buses um, to demand better public transport accessibility, to demand lift access. And the way they did that usually was to have several wheelchair users just park in front of a bus. And you can see photos of them doing that here with the Greyhound buses. Um, in a pinch, you can do it with two wheelchair users. It works best if they're power chair users. You have one in front of the bus, one behind. And what you do is you park, you detach your battery, you hide the joystick, and then suddenly you're anywhere from 100 to 300 kilograms of immovable object. The cops can't move you because they don't know how wheelchairs work, and they can't fit you into the back of a paddy wagon because it's not accessible. Um, so Adapt has found this to be a fantastically effective form of disruption action. In the decades since their founding, ADAPT has protested around public transport access, access to attendant care or support work, funding for the Medicaid program, accessible housing, and they've also protested against euthanasia and against institutionalized violence. These are some photos from ADAPT actions over the years. And in the corner here, we have John Hoffman, Anita Cameron, and Mira Murillo. Anita in the middle is a trailblazing activist who's been arrested over 100 times for civil disobedience over 37 years. And some of the activists who were really central in the 504 sit-ins are still organizing with ADAPT and still going strong after nearly 50 years, which gives me a lot of hope. Coming back to Australia, the Australian disability rights movement learnt a lot of lessons from American organizers, and they used very similar tactics. On the right here, we have Jeff Bell, who was one of the founders of the um, Handicapped People's Union, which then became the Handicapped People's Alliance, which then became People with Disability Australia. Um, in so there's I won't read out all of these again, but they had a lot of actions that were basically sort of 10 to 15 people disrupting a public space, making a demand, and these tiny protests were actually really effective. The protest at the Eastern Suburbs Railway in 1979 is the reason why we got the taxi transport subsidy service. It's one of the reasons why we now have, I won't say accessible, but more accessible public transport. Um, and yeah, like it's effective. They were very good at what they did. 1981 is sort of the turning point for Australia. That was when there was a big conference, a big international conference of disabled activists, and that led to 1981, which was the UN International Year of Disabled Persons. And from that, we have a bunch of groups springing up all over the place. The Australian Quadriplegics Association, the Handicapped Persons Alliance slash Union, um, you know, the Women with Disabilities Feminist Collective, and a lot of these became the DPOs we know today, the Disabled People's Organizations, People with Disability Australia, First People's Disability Network, uh, National Ethnic Disability Alliance, Children and Young People with Disability, Women with Disabilities Australia. I hope I haven't left any out, but if I did, it was not intentional. I am recovering from COVID and slightly feral. Um, and we also had in the late 80s and 90s, we had disabled activists found the Attendant Care Coalition, which essentially we can trace the establishment of NDIS to these groups. In 1991, Bronwyn Moy and the Citizens for Accessible Public Transport blockaded Broadway in Sydney to protest against public transport and accessibility, and that is the reason why buses have ramps now. Thank you, Bronwyn. Um, Uncle Lester Bostock was a disabled bundling activist who was a founding member of Radio Redfern, Black Theatre, and Metro Screen. He was a very, very, very pivotal and involved activist in Aboriginal organizations in the 60s and 70s. His was the first Aboriginal voice heard on SBS Radio, and he helped set up the SBS Aboriginal Radio Project and the SBS Aboriginal Unit. In 1991, he spoke about the experience of the double disadvantage of Aboriginality and disability. Auntie Gail Rankin was a disabled Garangeri and Kaurna activist who has represented Australia at the United Nations in Geneva and New York. And this picture on the right is Dean Smith at a protest with the Australian Quadriplegic Association outside Parliament House, Canberra in 1992, where over 70 wheelchair users gathered to protest for attendant care/support work. And again, we can trace the establishment of the NDIS to these groups and these activists. A lot of them were consulted in the early days of sort of putting the NDIS together, and not always listened to, but um, is what it is. So I want to talk about the difference between disability rights and disability justice, because everything I've been talking about so far is disability rights activism and organizing. The disability justice movement was founded in 2005 by a small group of disabled activists in the Bay Area in Turtle Island: Patty Byrne, Mia Mingus, Leroy Moore, Stacey Milburn, Eli Clare, and Sebastian Margaret. And the disability justice movement was kind of a reaction to what they saw as the failures of the disability rights movement, which were that they thought it was too white, too focused on incremental legislative reform, and too focused on acquiring legislative rights that would then only be afforded to certain groups of people, to citizens, and essentially the difference between these two movements is disability rights is focused on legislative reform, appeals to the state. Please, sir, can we have some rights? And disability justice is more about community building and about trying to build and create a more liberatory world, but sorry, my cat's sprinting. A long-term and lasting collective liberation. So looking to the people and not to governments and not to police and prisons to be the deliverers of justice. And the disability justice movement resists marginalizing economic and social factors and sees disability as bound up with other avenues of marginalization, including race, class, sex, gender, sexuality, faith, citizenship. And it recognizes that everyone has worth regardless of their productive value or perceived capacity to contribute to society. And this is Leroy Moore, this is Patty Byrne. These images, I think, really express the values of disability justice. All bodies are whole, all bodies have strengths and needs that must be met. We are powerful not despite the complexities of our bodies, but because of them. We move together with no body left behind. Only universal collective action can lead to universal collective, gonna guess that says liberation because it's cut off by my screen. Freedom, access, whatever.
It does, yep.
Thank you. And these are the 10 principles of disability justice as set out by that small group of activists and SINS Invalid. Number one, intersectionality. So they recognize that oppression is multiplicatory, not additive. So when you have someone who is queer and disabled, maybe the queer housing services do not take into consideration accessibility needs. Maybe the you know, support, maybe it's really hard to find support works that are trans friendly. Like, you end up with unique problems that are a result of those intersections and not just, you can't approach them as single issue struggles. Secondly, leadership of people most impacted, which I think speaks for itself. Third, anti-capitalism. They explicitly position themselves against a capitalist framing of worth and productivity. Fourth is cross-movement solidarity. So again, think of the 504 sit-ins, and think of Audre Lorde saying there is no such thing as a single issue struggle because we do not live single issue lives. Um, Five, wholeness. Again, no single issue struggles, no compartmentalizing of fights, no like let's do class now and tackle race later, no like, you know, incrementalism. Six, sustainability, which is about making sure we build a movement that can sustain itself and doesn't just kind of fall apart when people get burnt out or tired or disabled. Um, Seven is cross-disability solidarity. And there's a history of like very siloed disability movements. So you have deaf and blind people organizing in their own corners. You have wheelchair users organizing in their own corners. You have different kinds of disabled people organizing for their own needs, but not advocating for each other's needs and not moving together to fight for each other's mutual liberation. Eight, interdependence. So rather than just fighting for independence, for independent living, as the independent living movement did, the disability justice movement fights for interdependence and recognizes that everyone is dependent on each other. If you've ever been to the grocery store, you're dependent on a society. If you've ever caught a bus or a train or, whatever, if you've ever been to school, um, ideas of independence are very much bound up with how the world is designed to be lived in and how the world is designed to be navigated. And disability justice rejects the idea that we should seek independence and instead strives for interdependence. Nine, collective access. 10, collective liberation. Um, this is from a really wonderful little booklet that you can, um, it's online. You can also get a physical copy from Skin, Tooth and Bone. The Basis of Movement is Our People, which is basically a sort of disability justice primer that Cinzia Villard put together. Um, I have not written this down. I can't see the whole quote on my screen, but disability justice holds a vision born out of collective struggle, drawing upon legacies of cultural and spiritual resistance. Within 1,000 underground paths, we ignite small and persistent fires of rebellion in everyday life. Disabled people of the global majority, Black and brown people, share common ground, confronting and subverting colonial
Powers.
powers in our struggle for life and justice. There has always been resistance to all forms of oppression, as we know in our
Bones.
bones. But there have also always been disabled people envisioning a world where we flourish, a world that values and celebrates us in all our beauty. Um, this is something I borrowed from the Whistleblowers, Activists, and Communities Alliance. It's not exhaustive, but it I think gives us some interesting ideas about how to think about different kinds of actions and different kinds of activism. So they talk about action first versus team first. Action first prioritizes information security and anonymous action. So stuff like citizen science, stuff like anonymous, stuff like whistleblowing. It's good for single actions, short-term goals. It has predetermined and usually strict roles. And it is potentially capable of sort of riskier, more high impact actions. Team first prioritizes relationships and pre-existing social structures. It's good for longer term movement building, community building, in that we have flexible, multiple roles. People can sort of move into different positions within the movement. And that works from creating affinity groups that build internal trust and capacity for sustainable organizing. So groups like ACON, groups like the Black Panthers, groups like uh, any local grassroots movement where people sort of bound by a common struggle and a common purpose, we'd call that team first. And the flexibility there can sometimes be an issue. It can also be kind of cliquey. Um, it's sort of both less and more accessible in different ways, depending on what your access needs are. Um, and I have here just a little list that I threw together. Again, not exhaustive, but in terms of thinking about types of actions, we've got the marches and rallies, which I don't know about everyone here, but I find that they are not the most accessible form of protesting for me, mainly because of COVID safety, but also because when I'm wheeling around the streets at a protest, if I am moving with a rally, I can't use my wheelchair motor because it's too fast, and bipeds are too slow. So I have to like haul up the whole way, and that's really exhausting. And it's not for everyone. And I also can't do it in the rain. Um, but luckily we also have all these other types of activism, activist action, including demonstrations, including speaking events, conferences, workshops, sit-ins, die-ins, walkouts, strikes, pickets, vigils, memorials, civil disobedience, lawsuits, boycotts, divestment, sanctions, mutual aid, letter writing, calls, petitions, protest art, social media, culture jamming, online campaigns, electoral organizing, hacktivism, community building. And these are just some of the ways that we can intervene and come together to make good change. So what can you do? Um, Learn from history is always my first answer. Learn from those who came before us. We are never starting from scratch, even if we feel that we are or think that we are. We always have lessons to learn from the people who fought for us to get to where we are now, and we can build on their work to do better work. Um, get in where you fit in. Don't feel that you have to go to all the rallies or you know, be really vocal on Twitter or like there's no one way of doing activist work. We need people behind the front lines as much as we need people on the front lines. We need people organizing bail funds. We need people holding the media to account. We need people doing all sorts of things in all sorts of roles, in all sorts of ways, in all sorts of places. Um, Again, with the not having to start from scratch, look for spaces that already exist and build up. So one of these is unions, one of these is nonprofits, one of these is grassroots community collectives. And even if these spaces aren't necessarily disability literate, bring your disabled selves to those places and make them disability literate. Like, join the struggles because you are always going to be better off when you have a structure to work with. And when you're not sort of doing things all by yourself with a small group of people, I speak from experience when I say that that is not sustainable and it will fall apart and you will get tired. Use your existing skills, upskill where necessary. Upskilling can look like learning Auslan, learning how to translate documents and materials into easy English. It can look like learning how to use a megaphone. It can look like learning how to drive, so you can drive people to rallies and it can look like banner painting. It can look like all sorts of things. Lastly, but certainly not least, challenge your assumptions about what is possible. Um, because I find that the most limiting factor is often when we think that we cannot make a change or that a change is not possible. We know from looking at historical activism that people have already made such drastic, drastic changes to the world we live in, and nothing about the current state of things and the current state of power is natural or inevitable. We can change it, and I think we will. Um, these are some useful questions to ask yourself. If you want to get involved, what resources are needed? Who's going to supply them? What skills do you bring to the table? What skills are missing from particular groups? Are you politically aligned with them? Do you agree on methods of political change? If you don't agree, can you still work together? And you don't have to like each other to do activist work together. That's another really, really important thing. You do not have to like each other to work together. You do have to be politically aligned, at least sort of broadly. Um, and is the direct action or collective organizing strategy being discussed something you feel secure and safe being involved in? And there are different levels of risk and different levels of liability. If you're um, physically or cognitively disabled, your risks are going to look different to those of an able person. and it is fine to take that into account. It is good to take that into account. Um, and um, it doesn't make your contributions less valuable. Um, and I'm almost done. This is the origin of the phrase "standing on the shoulders of giants" is the Greek myth of the dwarf Kedalion standing on the shoulders of the blind giant Orion, so that they could meet each other's access needs, so that Kedalion could use Orion's big legs and Orion could use Kedalion's sharp eyes to see where he was going. So this phrase that I love and I think is so important for activist work is itself from a parable about mutual disabled um, interdependence and and about disabled people meeting each other's access needs. I'm not going to read all this out, but when these go online, these are just some ideas of places you can connect, spaces, things you can do. If you want to get started, but you have no idea where, here are some options. Not your only options, but potentially a starting point. And here are some links, resources, and some more links and resources. And I'm done.
Thanks so much. Did you want to take a break?
Yes, let's do a 5 minute break. I'm gonna go have a smoke, and you can go to the bathroom, or you can think of some questions to ask, or whatever else you would like to do. I need to stop this. Hang on. Okay.